So, lots and lots of new developments this week in the race to vaccinate. And here to help us understand all of it, we're going to bring in our friend and medical expert, Dr. Arnold Baskies. He's the past chairman of the National Board of Directors of the American Cancer Society and the chair of the Global Cancer Control Advisory Council. Dr. B, good morning.
Hi, Stephanía.
So first, we wanted to ask you about something non-COVID related. We've had a few people ask us how you were doing because they noticed some of the bruising. So could you just kind of calm everyone down and tell them you're okay?
I'm fine. It's got nothing to do with COVID or my wife. It's got to do with the fact I had some fairly intricate eye surgery done this earlier in the week, and I'm recovering now. So thank you for the concern.
Okay, so you got it, everybody. Dr. B is just fine. All right, and that's why he's here today. So on Thursday, the CDC said that it had reports of approximately 5,800 so-called breakthrough infections out of the nearly 77 million people in the U.S. who've been fully vaccinated. Now, is that the number that we expected to see based on the clinical trials?
Actually, it's a good number, Stephanie. Americans are getting a real crash course in statistics. If we do the math, the 5,800 cases out of 77 million people who have been vaccinated, that comes to 0.008% of getting an infection with COVID if you have been vaccinated. Think about that. 0.008% chance if you've been vaccinated. That means you are essentially bulletproof from COVID if you've been fully vaccinated. There's a growing body of evidence from this country and as well as from Israel now, which more than suggests that fully vaccinated people are less likely to have asymptomatic infection and potentially less likely to transmit COVID to others if you have been vaccinated. Essentially, the early studies that showed that you were about 94% protected if you got vaccinated have been more than validated by real-life experience from millions of people now. We also know that the protection lasts from the vaccination for a minimum of 6 months and will probably last longer. If you wanted to create a list of modern scientific miracles, the COVID vaccines would be at the top of the list. So get vaccinated.
You said this before, which I think you need to put on a T-shirt, get the vaccine or the virus, right? Now, you said this before, but, when it comes to all of these cases that we're seeing, I mean, I like that you said that, we're getting a crash course here in statistics. Just kind of explain a little bit more about that, because we've talked about this over and over again. The vaccine is intended to basically not just if we get the virus for us to not go to the hospital or, unfortunately, die.
Right. So the vaccine protects you from getting really sick from COVID, okay? You might get a mild case of COVID if you do get vaccinated, but the chances of that are infinitesimally small. And if you hang out with people who have been vaccinated, the chances are even smaller. You're never going to get to zero, but 0.008%, 0.008% chance of getting COVID if you've been vaccinated, I don't know anything that's better than that from a vaccination point of view. It's an amazing statistic.
You're arguing here for vaccinations, yet we know that hesitancy is a real issue. Philadelphia on Friday opened up the vaccine eligibility to everybody over the age of 16, which sounds good, but officials were able to do it earlier than expected because a lot of appointments are going unfilled. So that means that some people are just not getting the vaccine.
Well, you're right, exactly. It's both good news and bad news that they've opened up the age brackets. So far, in Philadelphia, there have been about 650,000 doses given to Philadelphia residents in a city of 1.6 million people. That's about 40% of the population of Philadelphia that's been vaccinated. We have a really, really long way to go in urban centers like Philly. I hope that I'm wrong about this, but with the widening eligibility to younger folks, while it's a good thing, it implies to me that there are a large number of older people who either do not want to be vaccinated yet and are waiting, or they don't want to be vaccinated at all. And that, to me, is what this implies. I hope that isn't the case, because the longer it takes to get urban groups vaccinated, the more people will be ill, the more drag there'll be on the hospital systems, and the more drag that there will be on our ability to get back to the way of life we had before we ever heard the word COVID. So it is a little bit disconcerting that we have more vaccines than we have people that want it. And it's not a great statistic.
All right, we'll see if something changes or gets better with that. Dr. B, thank you so much for joining us and sharing your insights.
Thanks, Stephanie. Always great to see you.
I'm glad you're well. All right,
Thank you. Right, bye-bye.